Sickle cell disease is a disease of the red blood cells in which the red blood cells look different than what normal red blood cells do. They become oblonged and deformed, and because of this deformity, these red blood cells carry less oxygen and also have more of a problem of sticking and clumping, which can lead to all kinds of various diseases. This is a genetic disease that is caused by obviously a genetic defect, which when both parents must have this genetic defect in order for the person to have the disease. If only one parent has um, has the defective gene, then that child will become a carrier of the disease, but will not have the disease. Um, Approximately 100,000 people suffer from sickle cell disease. Most of those are African American. 86% of those people who have that disease are African American. White is 2.5%, and multiracial is 1.2%, with unknown being approximately about 10% of the population of that 100,000. Home treatment includes several different types of herbal remedies. These herbal remedies include papaya extract and the Faga herb extract. Again, both of these have anti-sickling properties, which help prevent the red blood cells from deforming and also help relieve some of the pain and other associated symptoms with these things. There's also some some certain prescribed medicines that they may receive from their physician, which help treat the disease. And over-the-counter medications such as ibuprofen and others help people deal with the pain that results from this disease. The other thing that these people can do is they can take warm baths and use relaxation techniques to help prevent the spasms and the vaso-occlusion that occurs with this disease. So how do people avoid getting into a sickle cell crisis? Well, one is staying hydrated. Staying hydrated helps provide more plasma, which allows the sickle cells or the cells to flow through the bloodstream easier and helps prevent the crises from occurring. Um, they shouldn't overexert themselves. Overexertion again causes a lack of oxygen, and since these red blood cells don't carry oxygen as well, they can get to in crisis. So, and extreme in temperature also causes these problems, such as extreme heat, extreme cold. Either or can bring about a sickle cell crisis for these people. Again, no alcohol due to the risk of dehydration. And again, avoiding hyperactivity, stress, overwork, things like that can will help prevent a person from having a sickle cell crisis. Sickle cell disease can lead to all kinds of different problems. One of the specific ones that we'd like to talk about for a moment is the acute chest syndrome. The acute chest syndrome happens within obviously the chest and the lungs, which can also lead to pneumonia because of the blood not circulating very well through the lungs. It can also end up being a fatal problem, along with several other problems with this. So, how do we treat an acute chest syndrome? Pretty much we're going to follow the same ABCs that we use. And we're going to make sure that maintain airway, breathing, circulation, high flow oxygen. We can use nebulizers because we'll probably have wheezy or somewhat unclear lung sounds in this situation. These people have an awful lot of pain with the various types of sickle cell crises which they occur, and so they may have a very high pain tolerance. So not only do we need to think about pain control, but you have to use more pain control than what we normally think is necessary in these people. In-hospital treatment will include probably transfusions to help replace the defective red blood cells. There is one small advantage to people who have sickle cell. Sickle cell helps prevent people from getting malaria, as these cells are easily destroyed as it goes through the bloodstream. And so there's a preventative thing for that. So that is all on sickle cell crises. I hope you've enjoyed this little chat, and have a good day.